So Matt, we were touching in the first video on what the evidence is around what clients and patients want in their therapy and counselling, and maybe some surprising findings about them wanting a bit more of a gentle push, a bit more challenge and direction in the work than maybe us as the therapists and counsellors think at the beginning of the work. But of course, we need to try and find that sweet spot between providing that foundation of empathy, the safe space to explore feelings, and the challenge and the stretch. That is a really difficult trick for clinicians, therapists, counselors, others in the mental health professions. That's a really difficult trick to pull off. How do we find that sweet spot? How do we work towards it?
So really interesting question. On that study, so just 10 seconds on that. So led by John Norcross in the US and Mick Cooper, who's here in the UK at Roehampton, who people probably know quite well. It's a study from a couple of years ago. Really large sample size, so over 1,300 people involved in that. And what it found essentially is what you've said. That 70% of people wanted their therapist to focus on goals, wanted them to provide structure, and wanted them to take the lead. So it's what Mick Cooper sums up as a directive approach. He also calls it active, structured, and educational.
It's worth pausing on that for a second, isn't it? Because that's 7 in 10 people who are saying they want goal-orientated, directional therapy. That's probably a lot more than most people watching this video would have anticipated before they press play, I imagine.
I think that's right. Certainly, even though I see that in my own practice, the percentage was higher than I would have supposed. And the percentages don't add perfectly to 100, but it's only 15% of people who want something which you'd classify as non-directive. So 15% of people, 15 in every 100, it's not an insignificant number, right, but vastly, it's outweighed in terms of the people who are actually looking for a bit of guidance, direction. And of course, when you ask therapists what their preferences are, it's the other way around. It's almost the complete inverse of that. So you've got kind of quite an interesting start point on that. I mean, I think in the end, the question that you ask around empathy and challenges are really two sides of the same coin. You can't have one without the other. So for me, it's not a question of either or. It's more a both and. And the analogy that we've sometimes talked about is with a massage. So to feel any kind of benefit from a massage, there is going to be a degree of discomfort. But if there's too much discomfort, you're never going to go back. But similarly, if it's too gentle, it's just not going to be of any lasting benefit. So I think we're trying to combine care with concern and challenge in the service of change. There's a nice quote from Lawrence Friedman, which is something like the analyst must accept the patient. So using sort of what I consider sort of slightly old-fashioned terms, but the analyst must accept the patient on their own terms, and at the same time not settle for them. So I think that idea you talked about before, that there is that warm accepting, and there is also that degree of challenge and push and belief, and in terms of what the client might be able to achieve, what they might be missing out on, what they might want to do more of.
Yeah, it's balancing that classic idea of meeting the client where they are when they come into the work, but also holding in mind and working with them to understand where they might get to, and holding on to that image maybe at the times of the work where they're struggling to hold on to that themselves too.
And often they've done parts of that. I think some of what's interesting about the solution focused approach is you're latching on to even very small things. That the client has turned up might be the smallest. Might be the smallest thing. If somebody's in a state of great despair, the smallest thing might be that right now they're hanging on in there. And there might also be other moments in their life where they've really been able to put things together and get joy. And it's thinking about, what was particular about that. Can any of that be revisited and drawn upon?
Great. There's some lovely and helpful examples throughout the literature, the therapy literature, on therapists challenging their clients, some slightly more strident and direct than others. One that a lot of people, I imagine, are familiar with is from Laurie Gottlieb's book, Maybe You Should Talk to Someone, where she's actually writing about her own therapy in that work, and talking, I think, about a relationship that is recently broken down, and she's talked for a number of sessions about the pain and the distress that she's in, but also by her account as well, moving into a slightly more self-pitying, wallowing state. And her therapist stands up and just gently gives her a little kick, not a firm kick, but just a little kick, and says something along the lines of, you seem to be enjoying yourself in that self-pitying, self-destructive place. And Laurie Gottlieb writes about how she finds that quite helpful, quite a stark and striking moment of connection, but also helping her move into a different place. So an example of where that direct challenge helped move her into a different place. But I could see an example like that backfiring, right? I could see with a certain type of person, the therapist getting out of their chair and giving a playful kick to their client would go down like a lead balloon and be really quite a rupture in the relationship. So what do you take from that example? And does that resonate with the way you bring challenge into your work with your clients?
Yeah, I think I share your misgivings. I can't quite see myself doing precisely that. But I think the thing about that is, as you were alluding to there, it's kind of playful, isn't it? It's really resting on a relationship which is already set. It's on the foundation of empathy and kindness, I think, and it wouldn't work if it felt any other way. So
Right.
I think, you know, the risk that you identify is the real one, and there's always that bit of judgment taking place there. But I think challenging through kind of playful comment definitely works. And in terms of sort of broadening out the question, I certainly would see it as my responsibility to find a way to try and challenge the client in that type of situation, to challenge the self-destructive element of the behavior, to try and help them perhaps move back towards their goals. If we've been clear about what it is they're working towards, the challenge might be to bring them back to their goals. I was thinking of an occasion when I was with my therapist, and I was, I don't know, holding court about something or on a spiel. And I got to the end of this sort of long kind of ramble, and I said to him, so I don't know what you make of that. And truthfully, what I expected him to do was have been thinking very carefully about it, reflecting.
Sounds very difficult.
Yeah, well, yeah, or reflecting on what the themes might be, or offering something of an interpretation, you know, that he would connect it up with something else I've been saying, or some themes that we previously talked about. And what he said to me was, when I said, I don't know what you make of that, he said, well, it's a bit self-indulgent, isn't it? And it made me laugh out loud, because it was true. I mean, it was exactly as he said it was. He tends to be a man of relatively few words, so that was all he said. And I think all that needed to be said in that moment, but it didn't feel harsh. It felt like he was naming a tendency that I have, that we've talked about in the past, that I've said, you know, I want to think seriously and carefully about this, and I'd like to do something differently. So I think he was doing it in a respectful way, even though I think on the face of it, it could come off as somewhat
right. Yeah, that's really helpful. Well, one of the risks for us in our work that someone like Erwin Hirsch has highlighted is this idea of coasting, what's called coasting in the countertransference, but really is putting the finger on something which I think is a risk for all of us, which is around that we coast in the work because it's comfortable. It might be comfortable for us for a range of reasons that prevents that challenge or makes us nervous to challenge. So that might be that we have a financial incentive to continue working with clients that we need to acknowledge and find our own way through. It might be because we like the client in front of us and we don't like the idea of ending the work with them. How do you make sure in the work that you do that risk of coasting for one reason or another, how do you make sure it doesn't get in the way of the work with clients? But if you do notice that you can't provide that challenge for whatever reason, you don't feel like you're the right person to challenge that particular client, what do you do and what actions do you take?
Really human impulse, isn't it? That I think,
I
think it's unique to the therapy or therapists. I think it's sort of common in all professions. We're human and we quite like to be comfortable. And I think in therapy, we often like our clients and we want the best for them. And sometimes that means really fearing that we'll hurt them, or that it feels like there's a risk we might push them away if we're too challenging. So I think the money matters and might be coloring our approach, but I don't think it's the only thing. I think there's something really important about recognizing our limits. You know, this is sort of one way to answer your question. I see so many therapists' profiles, and they're listing hundreds of things that they work with, from depression to OCD through to addiction. And there's a kernel of truth there, isn't there? I think that there are some of the foundations of therapy tend to work for most people.
Yeah.
That's a finding within the research, but equally the research finds there's really strong evidence that certain forms of therapy work better for certain conditions. So the things I've got in mind there as an example, you know, the form of CBT, which is known as exposure and response prevention, which seems to work particularly well for a condition like OCD, and then even more generalized CBT for anxiety. You know, there's a wealth of evidence to recognize those as first line treatments, much more so than other types of therapy. So I think, you know, you and I say that if you don't practice that particular form, you know, the exposure and response prevention, it's probably better that you don't take on clients who've got a diagnosis of OCD.
And if we think about challenge, you're not going to be able really to provide the kind of challenge that someone who's suffering from OCD will benefit from.
I think that's exactly right. And just to nuance it slightly, my own view is that you can work with people who are in active addiction without yourself having been in recovery or been through that experience. But it is harder. It's harder to understand the experience. You know, it's harder to be credible, and it's harder to engender hope that there is recovery when you don't have that experience to rest on. It's not quite so personal, but it can be done if you're willing to go the extra mile. I think you see that in anecdote, and you see it borne out in the research as well. So one of the other elements in terms of limits, I think, is also personalities, right? So that's the thing we don't tend to talk about very much, but I think there are people with whom you click, and there are people with whom I sometimes think, for whatever reason, this isn't quite going to work. I don't think I'm.
And what do you do in that situation? What would you advise other therapists and counselors to do in that situation?
So I think sometimes you can be yourself with more skill. You know, sometimes you can adapt, you can make an accommodation. You know, you can talk seriously to the client about their preferences and consider moving and shifting your approach and how you would be. But in the end, I think probably the simple answer to the question is you probably would refer that on. So just as you would if you were working with a condition that you didn't fully understand, that you didn't feel steeped in, that you didn't think you could bring help and expertise to, I think in a situation where you're not connecting with that person for whatever reason, you know, and sometimes it's a bit mysterious, isn't it, why we get on with people, or why they call out to us in the way that they do, or why we feel a bit like, don't think this one's for me. I think referring on is a really important thing to do. All the way back to the idea of coasting, I think it's really important that we challenge ourselves. Am I in a position to seriously help this individual change in the way that they want? If the answer's yes, great, go for it. If the answer's like, I think so, but I'm going to need to read a little more, I'm going to need to take a consultation with somebody, that's the answer. But I think often the answer should be you refer that on. You refer the person on to somebody who can help more. Great,
thanks. We'll leave it there for video 2. In the final part, we'll look at a few more specifics on what counselors and therapists can do to work towards challenging their clients more effectively.